This is Raj Gupta. I'm talking to you from Vanderbilt University Medical Center in Nashville, Tennessee, and this is my short video on how I do it for some fascial plane blocks. PECS 1 and PECS 2. Alright, so Nick's lying supine, and I'm scanning just below the clavicle, sort of like you do an infraclavicular block, and we're going to look for the pec major and pec minor muscles. So if you look here, you can see the pec major muscle sitting on top and the pec minor muscle sitting below, and below that you get the artery and the vein of the axillary artery and vein. A PECS 1 block is performed in this plane between pec major and pec minor. And as you slide laterally, a PECS 2 block is done below the pec minor. Alright, so let's talk about the serratus now. I generally like to do the serratus with the arm up, and you're scanning first to look for the ribs. Typically you're looking for the fourth rib, and you want to see it in cross section. Now some people will do the injection in plane, and I find this to be a little bit difficult. I often do my injections out of plane so that you can travel a shorter distance with the needle right to the plane that you're interested in. So here we're scanning, and you can see the rib. And you can see the pleura sliding in between the rib. And the serratus muscle sits right on top of the ribs. And again, some people will do the injection above the serratus muscle. Alternatively, you can go below the serratus muscle, depending on what type of spread you want in this area. And then the last component of a chest wall block is the PectoIntercostal fascial block. This is getting the anterior divisions of the ventral rami as they innervate the sternum and the medial chest. Here you're scanning just lateral to the sternum, and you see the costochondral ligament here. And if you go below that, you can do your injection right below the muscle.